welcome to another edition, another episode, interesting episode of Family and Society Talk Show on WFM 106.3, The Power of Talk. Today, I'm going solo. My teammates, none of them are here today. Kelechi is away, Christine is away, but it's fine, it's okay. As usual, I'm not alone. I have guests. August visitors, actually, August guests, or I should call them so, with me in the studio this afternoon. Even as our topic of discussion today is going to be really very interesting. So I urge you, listeners, to please pay attention to what we're going to talk about today. Tomorrow, the 26th of June, is the day for the International Day Against Drug Abuse and Illicit Trafficking. So for that reason, I would like us to talk about that drug trafficking, illicit trafficking today. Actually, this year's theme is addressing drug challenges in health and humanitarian crisis. We're going to be talking about this. We all know how it is as far as drug is concerned, as far as drug addiction is concerned, how it's lavishing away our children, the teenagers and youths of our nation, not even limited to that, including adults these days, are like lavishing away in a drug addiction. We want that, in fact, if possible, we want to say a no and bring it to a zero level as much as possible, so that our children can be healthy. We can have healthy and children with sane mind moving about our streets and our societies. So this is why I feel is very, very vital and very important for us to talk about this topic today. My name is Elizabeth Samsedi. This afternoon, like I said, we have a very important guest with us in the studio that is going to download all that we need to know concerning this topic. I have with me Mr. Muhammad Ajiya. He's a commander of narcotics. He's the NDLEA FCT commander. You are welcome, sir.
Thank you.
And some of his colleagues, the deputy commander, sir, if I'm not mistaken, is also here to join us to do justice to today's topic. Once again, you are welcome, sir.
Thank you.
So, sir, starting with, I would like you to tell us what drug is and what drug abuse is. What's the difference between drug and drug abuse?
Well, so drug can be defined as any substance when taken, that substance has the ability to affect the way the body functions. That can simply be defined as drug. Any substance when taken, whether it is in a liquid, gaseous, or solid state, when it is taken and that substance has the ability to change the way the body moves, the way the body works,
yes,
that substance can simply be defined as drug.
Okay.
Now, drug abuse can be defined as taking of all these substances in excess. If you take them in excess, you are said to be abusing this drug. If you take them without prescription of doctor, you are said to be abusing these drugs. If you take them in a manner that deviates from legal manner, you are said to be abusing that kind of drug substance. So drug abuse is a situation when a person takes drugs in excess form that is not within the medical threshold, or when you take it in excess, or when you take it in a manner that deviates the legal way that you are supposed to take that drugs. You are said to be abusing the drug.
Okay, you mentioned, you said something legal.
Yeah.
When is drug legal and illegal?
But we have drugs that are licit and we have drugs that are illicit. Now, licit drugs are the normal conventional drugs that we take, and illicit drugs are the drugs that are completely banned. You are not supposed to take, like the hard drugs we are taking about. There is a law as it affects taking of hard drugs. There is a law, and that is why we have NDLA today to enforce the law. So when you are taking hard drugs, for example, cocaine, heroin, amphetamine, etc., these hard drugs, you are completely going against the legal norms of a nation. So completely you are said to be it has deviated from the legal pattern stipulated by any country.
Okay. Hard drugs. What how do we now define drug addiction?
When somebody is hooked to a particular drug.
Whether
You
legal
know,
or illegal.
yes. Now, normally, you don't just jump into taking drugs. There are 4 stages at least. A user normally start by experimentation. They experiment this drug. Then from there, they graduate to a casual user. From a casual user, they now graduate to a regular user. From a regular user, they now become hooked, addicted to the drug. So these are the 4 stages. So somebody that is hooked to a particular drug, that person or that individual is said to be addicted to any particular drug that he or she uses.
Okay, so today according to our theme and our topic of discussion today is we're talking about how addressing these issues
Yeah.
of drug addiction, how it affects the health.
With you, how it affects the health
Yes,
and
and humanitarian
challenge,
yes
crisis. Yes.
Yes. So how does it affect the health of the addict?
There are numerous ways. Drugs, hard drugs, is of no good to us as human beings, and there are so many ways it affects the individual. An individual can be physically. There are physical consequences of abusing these drugs. There are social consequences, psychological consequences of abusing these drugs. We're talking about physical consequences.
Yes.
We have a lot of organs in our body.
Right.
We have the lungs, that's our respiratory system. Of course. We have the nervous system. We have the kidneys. We have hard drugs are capable of damaging all these organs in our system. The kidney will not function when you take normally. The liver will be polluted. It will not function normally. The lungs will not function normally. That's entirely your respiratory system. The nervous system will be affected.
Right.
So a lot of things will set in. Medical challenges will set in. You will not walk normal as a human being. You will not think properly as a human being because it affects vital organs in your body. So these are, again, we're talking about some psychological consequences. We have a lot of issues like it directly affects the community. We have broken home. We have people that cannot go to school. We have a lot of things like that. So a lot of things that are completely bad, a lot of things that the individual cannot work optimally, is all as a result of drugs. So we have a lot of reasons as to why, consequences of this drug on a particular human.
Then, we have talked about how it could affect psychologically. I would like us to talk about how mentally and socially, how it, when it gets to that social aspect of that addict, then it will extend to the society.
Yeah.
So can we throw a little more light on that?
That's what you know as a drug user, even to relate with your classmates, to relate with the society becomes a problem. There is stigmatization will come in. A lot of people will look at you as an addict, as somebody that is not important, as somebody that is into drugs.
Which is right, if I may.
Yes, it is. So a lot of people, but
yes,
the society is supposed to look at these people as somebody that needs help, not as a criminal, because they are addicts. Somehow they cannot control.
They need help.
They need help. So, but the society tends to look at drug addicts as if they are criminals, and that is why NDL is preaching. We don't look at addict as criminal. We look at addict as a patient that needs help. So, society has to embrace these people, embrace the problem, and also seek for help for these patients so that they will be treated and reintegrated back into the society, so that they will work optimally.
Okay, right at this point, I'm going to call out our phone lines. Listeners, please, we would like at this point for you to join in and be a part of this conversation in case you have questions to ask or you have a contribution, you have an experience you'd like to share with us. This is the moment where you can do that. Our phone lines are 0817 687 2132. 0817 687 2132 and 0817 687 2134. 0817 687 2134. Yes, sir. I just learned something now. Do you know that I had a different notion about NDLEA? I actually thought that you were there to like criminalize addicts.
No.
I never knew that you don't look at them as
We
criminals.
don't look at them as criminals. Part of the functions of NDLA is to arrest drug traffickers, peddlers, dealers, and their collaborators. One of our functions too is to completely rehabilitate those that are addicted to this drug.
Oh, you do that?
Yes,
Wow.
we have a facility in my office for rehabilitating addicts. We identify their problem as something that they need to be helped. So it is not it's an environment conducive for rehabilitation. It's like a school. We have a lot of experts in that field that will put them through so that they overcome their problem. Another aspect is when you arrest these peddlers, dealers, is you prosecute them, you take them to jail, of course. But for addicts, we rehabilitate them, we reintegrate them back into the society so that they will become useful members of the society.
Okay, for how long that rehabilitation? How long?
It
does
depends on
take?
the individual, how deep
It
that
has gone
person
in.
has gone in, how deep he has been affected with the drug. But minimally 3 months, 6 months to some, and a year.
Yeah.
Yes.
Wow.
Yes.
Okay. And have there been cases where some people came out of it and they became normal again?
Of course, they do come to greet me as the commander in the league.
Wow.
We have done a lot of rehab on a lot of individuals, and today they are happily united with their families. And occasionally they will even come in, pop in, and say, "Hello, commander. We are now back. I'm working here. I'm working there."
Wow.
Yes, so we've done a lot. Sincerely speaking.
That's good. Okay, at this point, I would like us to talk about the illicit trafficking, or the trafficking, the traffickers. I would like you to throw some light on that, sir.
Yes, illicit trafficking. When we say illicit trafficking, we are saying that the trafficking that is illegal.
So that that means there are legal.
Yes, of course, a lot of trafficking are legal, but there are illegal ones. For example, drug trafficking is illegal, and globally it's illegal. But you can do a lot of trafficking that are legal. You can move with your tomatoes, it's illegal.
Exactly.
I know, is it not?
Right.
So, but for drug trafficking, hard drug, it's illegal. Globally, it's illegal. Nations all over the world kick against because of the damaging effect, because they are economic saboteurs, because this drug money can be used to finance a lot of non-state actors. Like the Boko Haram, there is a link with drug. You know, their finances to some extent is coming from selling of drugs and all this is. You go to Afghanistan, you go to Colombia, all these places, there is a link somehow to the sale of drugs. So when people sell drugs, few people benefit from selling drugs, and those are the barons in the chain. The last person that will be used as a courier to transport that drug to a particular nation, more often than not, he cannot even see the baron. So it is the baron that benefits financially.
Exactly.
And if care is not taken, this courier that is using can even be arrested and executed in some nations or jail for donkey years. So it's only few people that benefit, but the teeming our youths that are easily prey to this kind of barons, it could probably because of unemployment in our society. They use them. You understand? A lot of people are looking for jobs, so they can just come and brainwash you that take this to the US, take that to a token will be given to you.
Exactly.
But because of people are desperate, maybe there is no employment in the society and things like that, they tend to fall prey.
Okay, sir. I like us to know the gravity of the punishment that is given to these illicit traffickers.
Yes, it's heavy punishment. You remember when General Buhari was the military head of state of this nation, it was even a death penalty.
Oh.
Yes, it was even a death penalty because some were executed as a result of drug trafficking. But somehow our laws has been amended, and now we have a maximum, I think, of 21 years imprisonment. But it depends on the discretion sometimes of the judges. Sometimes they give 3 years, sometimes they give 5 years, 10 years, depending on the circumstance. So, but maximally, I think it's 21 years in prison. So, if you are 21 years of your life is taken, you are virtually, you know, what else can you do in the society?
Okay, then there is this argument. Some people will say that alcohol is not a drug. They will say alcohol is not a drug. They will say tobacco is not a drug, and so is alcohol, tobacco, drugs?
Tobacco, cola nuts, coffee,
cafe.
coffee. These are drugs. These are what we call socially acceptable drugs.
Oh, socially
Acceptable drugs, because the society have accepted them. Hardly you go to a naming ceremony or wedding ceremony, you cannot find these kind of substances freely given to yes, cola nut, alcohol, even tobacco, even cafe. You take coffee more often if you go to these things. But these are drugs that. Why is it that in our university days, I remember when we want to go and read our books, some people will take Nescafe
to prevent them
from sleeping. So if you take something that has the ability to change the way your body works, it's a drug. I've already defined what drug is. You understand? But these are socially acceptable drugs. A lot of people don't know that alcohol kills, or alcohol is killing more than even the HIV virus. Because on daily basis, because as a result of taking excess alcohol, people are having accidents on the road, and it could be a luxury bus. 30, 50 people will perish at the same time. At the same time, it's not one individual that we are talking about. Somebody will go and take alcohol and fall in a gutter, break his leg. A lot of consequences as a result of taking alcohol. And if you quantify the number of people that are affected as a result of taking alcohol or that are dying, even the HIV/AIDS is not killing individuals like that. So cola nut is an alcohol because there is nicotine in cola nut. We have coffee, we have caffeine. So it's a drug. We have alcohol. Definitely, once you take alcohol, it changes you, the way you talk, the way you act, the way you do a lot of things. So it's alcohol. We've already defined drug. So it's drug.
Yeah, these drug intakes, they are in categories like you had earlier mentioned.
Yeah.
Is there a way we can break them into the different kinds of categories they fall into?
Of course. Well, drugs can be, I have said it, some drugs are in solid form, some drugs are in liquid form, some drugs are in gaseous form. So we have drugs that are in solid form, like the one that you sniff cocaine. Cocaine normally is in powdery form. Some people use an instrument to sniff the cocaine via their nose. We have the alcohol, which is in liquid form. You take it like a liquid form. You just take it, put it in a glass of cup, and you take it. We have those that are in gaseous form, where like
the one they inject.
Yes, we have those that you even inject intravenously. You inject, and injecting drug users, easily spread the HIV virus, because once they inject, they use a syringe. An individual injects, and he gives to the other individual.
Person.
He injects. So by so doing, they will be spreading a lot of the virus, So, and various kind of diseases, hepatitis, and all these things. So we have drugs that can also be taken in a gaseous form, like the thinner that furniture users use. They sniff it.
Oh.
Yes, it's in a gaseous form.
It's like there are so many these days. It's like there are different patterns. I learned there are some that are like sweets.
Yes,
that they share for school. Yes,
we have these days.
For school,
there is new
pupils.
innovation. You have cookies.
My goodness.
Mixed with cannabis sativa. You have cookies.
I learned even they do with cakes.
Yes, cakes.
Oh my
All
God.
these snacks that we take at your doorstep, parents, and that is why parents have to come in, because you don't just leave your kids like that.
Right.
A lot of people are so wealthy that their children can just order snacks and all these things. Little did they know that this kind of things can be used. Cannabis mixed with cookies, cannabis mixed with cakes, and all these things. Cocaine mixed with cake, cocaine mixed with a lot of brownies and all this. So a lot of parents have to wake up see who are the associates of their children, what their children are doing when they've gone to work. It has to be a kind of monitoring of our kids, because kids can now just online order that they need certain things that they see online.
Exactly.
And it is there that they easily they interact with these kind of people. At the end of the day, they will be supplying it.
Oh my goodness. Okay, our listeners, once again, in case you are just coming in, this is Family and Society Talk Show on WFM. We are discussing, our topic of discussion today is addressing drug challenges in health and humanitarian crisis. We are discussing this ahead of the International Day Against Drug Abuse and Illicit Trafficking coming up tomorrow. The actual day is tomorrow, but we decided to use today on this show to talk about this. And I have with me here the commander, FCT commander of the NDLEA. Is the one that is breaking it down for us, telling us how we should go about it as parents, how we should watch our children and try as much as possible to prevent them from going into all manner or any form of drug addiction. Sir, there's this very common one. I want us to talk about cannabis, marijuana. A lot. I really want us to throw light. I think it's about the most
commonly abused.
Yes, so I would like us to talk about, throw light on that.
You know, cannabis is one of the drugs that is produced in this nation. Now we have a lot of states, Edo, I know Delta, they produce it locally. And even in the north, some areas we have actually seen a cannabis farm and destroyed this. So it's a drug that is being produced all over the nation, Nigeria. And it is the most commonly abused drug because it is very cheap. It is one of the cheapest drugs. Just go by, you see the vendors, you see the peddlers, you see the selling them. What do you need? Maybe sometimes 20 naira or 15 naira you get, and you go and smoke it. So it is one of the most widely abused drugs in this nation. And it's doing.
And is it less deadly?
It's deadly because virtually all the feelings of when you take cocaine, you get it. When you take cannabis, all the feelings of when you take heroin or amphetamine and all these things, you get it. So it is seriously damaging our youth, and if you go to places like Delta, they produce tons of these things, and Edo State, I know, these are areas that they farm it, and they even some people are even talking about legalizing cannabis. Which
I think I've heard about that.
Yes, some people are even legalizing cannabis now that even the thing is not legal. Look at the effect on our youth. Talk less of when you legalize it. For medicinal use, that's what they are saying. Because every cannabis has its medicinal function, but when you use it properly, when it's that's how it's supposed to be used. But for the youths, they just drive fun, they just want to be high, and they take this
I wonder what they want to be high over. Oh my goodness.
They want to be high, etc.
I wonder, it baffles me when you say high. High over what?
Maybe
that's to achieve what?
It could be they will be having some problems. Problems like they're having problems with their parents. Maybe as a result of unemployment.
So the best thing is to go and get high.
Yes, momentarily you get high. After 1-2 hours, you still come back to and you'll be facing the same problem. So the problem is not gone. It's back to square one. You understand? So it's advisable that they completely abstain from themselves from taking it. It do no good to our whole system of the body. It damages somebody. You don't think properly. You do things irrationally. You not be loved even in a place that you work, and it retards your productivity.
Exactly. Yeah, I think that's it.
It's retarded because you cannot even in the working place you begin to do things that you are not supposed to be doing, and you get problem with even the management that employed you from the first instance.
So how would you tell a teenager or a youth to say no to drugs? What's the best way to walk away from drug addiction?
First and foremost, idea of wanting to belong to a particular group, to a particular society. You are in a school. There are some happening guys. They are always throwing parties in school, and you want to belong to that kind of. That is what actually pushed a lot of our youth to take in this road. Occultist members in our society, in the campus, you want to belong. They are doing a lot of things, throwing parties, and you see if care is not taken, you are not properly guided. You want to belong to those kind of things.
And to belong, you have to do what they do.
You have to do what they do.
That's what's for me. I don't know. Maybe because I'm old, it makes no sense to me.
It makes no sense completely. Even to a young man, it makes no sense. Why do you want to? Why can't you belong to, for example, religious groups that will help you spiritually? For example,
even if they are not religious,
yes.
Why the one that will take you into addiction? That will begin to damage your health.
But the youth of today, a lot of them want to experiment, do a lot of experimentation. To test this, to test that, to test this, to test that. That is what is actually throwing a lot of them in this kind of category. So they have to have that ability. Parents must come in. I always want to say parents must come in to guide your youth, to guide your children properly.
Sir, in defense of parents, let me speak. Because there are times that parents try.
Yes.
Some parents try.
Yes.
Yeah, I agree. That's what this program is called, Family and Society Talk Show.
Yes.
We talk family.
Yes.
Everything that has to do with family. We talk parenting. We don't pardon parents here at all.
Yeah.
We say it as it is. We give it hard to them.
Yeah.
But to be fair to parents, there are times that you bring up your child.
Yeah.
You monitor that child, and there is a limit. It will get to an extent where the child will have to go out there, go to school, go to work, and even get married and leave home.
Yeah.
So at that point, you can't just keep running after that child.
Yeah.
Okay, like you had earlier pointed out, in school, they get to school, they want to join groups, the happening groups in school, peer group pressures and all that. At that point, the parent is not there. So if that child decides to go into this and begin to take drugs, would you blame the parent at this point?
To some extent, because talking about peer group pressure, it is his friends that surround him in the community, that stays with him or in school.
Yes.
And it is expected that as a father or as a mother, as a parent, you are expected to know who you are children go out with.
Right.
A lot of our parents are so busy with their work these days, they leave early in the morning and they come back very late.
Right.
Some hardly even see their children. At the time they will come back to the house, maybe their children must have slept off. They will not meet early in the morning to this you have gone to school, they too have gone to school. There has to be a deliberate kind of to sit with your children, to check around and see who is this my child going out with, who is this coming to the house very often, and know the family that child actually is coming
from.
Yes.
That's another thing.
Yes. And what does the child do? What are his interests? What are his hobbies? Is it the kind of child that will push your own child to do this kind of things?
Exactly.
But a lot of our parents, a lot of parents just ignore all these things, and that is what is causing a lot of problems. Here, I receive a lot of calls about children threatening their parents. They want to kill them.
Wow.
At all hours of the day, please come, commander, send your men to come and arrest this child. Consent for rehab and all this. A lot of parents will complain when it is almost too late.
Wow.
Almost too late. And a lot of cover-up is coming from the parents too. They don't want their child to be to know.
Why?
They don't want their child to be identified.
I will expose you.
Of course, that is the best thing.
That is it.
So
because
that he gets the needed help.
For.
A lot of cover-ups are coming from the parents. They don't want maybe the society to know that my child is. But this is something that you cannot help. Yes, he needs help. Once you identify the problem very early, you address the problem too early before it gets out of hand.
Right.
Yeah. So I always say parents should be up and doing. Parents should do a lot of work on their children.
Right.
You must know who your child goes out with. You must know if it's a lady.
Who you are friends with.
Yes. So when we do that, we would drastically reduce.
Yes.
Reduce.
Okay.